We are live.
This is Center Appropriations, March 18th. We're going through bills, taking a break from FY27 budget testimony. And today we're going to take up Bill S220. We have joint fiscal here with us to walk us through the fiscal note on the bill. So I'll let you introduce yourself for the record.
Sure. Good afternoon, Julie Richter, Joint Fiscal Office. The fiscal note should be on the committee page under my name. I will say, before even going into the fiscal note, there are no appropriations or expenses made out of this bill. So I'm not fully sure why it's here, and I'm happy to walk you through it. So big picture, this is S220. This is the bill that was first introduced as the education spending cap bill. And then it has been since recommended to be amended by Senate Finance. It does a few things. All of them are centered around this tax mechanism that exists in education finance called the excess spending threshold. So the excess spending threshold essentially is if a school district's per weighted pupil spending, so it's that district's education spending divided by its weighted pupil count. If it exceeds a certain amount, then the amount that the school district has of per pupil spending over the threshold is double taxed for their homestead property tax rate. And what this bill does is it would amend provisions around this tax mechanism. So specifically, it lowers the excess spending threshold from 118%, which is in current law, to 112. And that percentage is applied against the fiscal year 2025 average per pupil spending and increased by inflation. So essentially what it does is it says, okay, in FY25, here's what the average per pupil spending was. We're going to increase it by inflation to the year in question, and then we're going to multiply it by a certain percentage. Of course, the higher the percentage, the higher the threshold, the less amount over that threshold that would be subject to a double tax. So this lowers that threshold from being multiplied by 118% to 112%.
Yes, Senator West.
Do we know how many communities, how many school districts that would affect?
Yes. So
This is a start for next year or the following?
yeah. So this would be for fiscal year 2028. So we don't know for fiscal year 2028 how many would impact because those districts haven't built their budget yet. And it's fair to assume that some districts might try to lower spending to sit below the threshold. Others might eat the double tax. In fiscal year 2027, there are, we don't have all updated budget data from school districts, but using our best estimates, there would be about 12 school districts or 10 school districts that would be hitting that excess spending threshold in the current law, the 118%.
Yep.
By decreasing it to 112, there would be 33.
Okay.
And I would note that that 33 estimate also includes another portion of this bill that I haven't spoken about, which is a hold harmless provision. So in addition to reducing the excess spending threshold percentage from 118% to 112%, Finance also included this hold harmless provision that essentially says, okay, if a school district's education spending did not increase compared to the prior year, or if their per weighted pupil spending did not increase compared to the prior year, then they're not subject to the excess spending threshold. So essentially, if they held the line on spending, either per pupil or total ed spending, regardless of their per pupil spending, they're not going to be subject to the excess spending threshold.
Because the per pupil spending, total spending, not just education spending.
Per pupil spending is education spending divided by the weighted pupil count. And education spending, you might recall, in ed finance is a technical term, and essentially what that is that's that school district's total budget minus all of its offsetting revenues, which are categorical aid, so the money they get from the federal government, special education, census block grant, transportation reimbursement, that kind of stuff.
So if I understand you, if they were over this year, but they level funded till next year, they would be held harmless.
Correct.
Okay.
Regardless of the per pupil.
Correct. So if they held steady on either total ed spending and or per weighted pupil spending. And then there's a third provision of that, which is that it's up to the secretary's discretion. So if a school district, if the secretary deems that the increase was for good cause or beyond the district's control, then the secretary can apply that hold harmless provision to another school district.
Does the secretary have that power now under the existing?
No.
And is there a process, or that's all the wording says? Just
I would defer to John on that.
That's all that there is, but I'll go over it.
Okay. Okay, so that's the reason it's here is because this affects expenditures and stuff. But usually their bills are here just for the appropriations, but this is a little different. Okay, well, we can ask other questions of the law of budget council. Does anybody have any other questions for joint fiscal?
If I may, there's one other provision that's included in the fiscal note. So we just spoke through everything that's included in section 2 of the bill. Section 1 of the bill expands an exclusion for the excess spending adjustment. So under current law, for the purpose of calculating solely excess spending, school debt service for bonds approved prior to July 1, 2024 are exempt. So essentially that debt service is not used for the purpose of calculating excess spending. What section 1 does is it removes that timing condition. So any debt service, regardless of when that bond passed, is excluded for the purpose of calculating
Any
excess
past
spending.
bond, any past, oh no, but any new bonded debt would also be exempt.
Yes, exactly. So that would expand an exclusion, so that essentially would make it so that there would be more costs in the education fund that would no longer be calculated in excess spending.
And the bonded, is there something like the bond, it's not just that it's a bond, but it was a bond voted on or something like that?
So under current law, it's that bond voted prior to July 1, 2024, and this strikes prior to July 1, 2024. So it just says any bond voted. So if a school district has debt service in its budget and this were to go into effect, then that debt service would be excluded for the purpose of calculating excess spending.
But they could have debt, in the future, they could have debt, but the only thing that's exempted is if it's voted bond with debt.
Oh, that's a great question, also for John.
Okay.
That was my question.
Okay.
So it's going forward forevermore and not just, okay.
That'll be one of the questions we'll ask Ledge Council whenever they get up to the table.
I'll do that.
Thank you.
Yeah.
Would you like?
Yes, no, it would be great.
So, afternoon, everyone. John Gray, Office of Legislative Counsel. I will screen share with you, but first I'll just try to answer those questions if I can. So I don't think the voter approved qualifier that you see to that language is meant to be exclusionary in any broad form. That's the way that that is authorized for school districts. So you can think of this as truly just removing a temporal limitation that exists, which is there's a cutoff date of July 1, 2024. Now there's no cutoff date.
Because there's other statutory restrictions on schools.
On the ability to bond, exactly.
Yeah, they have to go to a vote and they have to
Yep.
warn it and all that stuff.
And none of those processes are disrupted by this bill. All of this, and I'll show you the language. This just says, you know,
You don't happen to know, there must be a threshold, but maybe not. Maybe any debt has to be voted on by the citizens of the district.
I can check
This
after
one's-
this, but that's my,
So even if you wanted to borrow $5,000, they'd have to go to a vote. I don't know why they would want to borrow $5,000.
yeah, I would want to
Okay.
confirm before, yeah. Okay, so I will screen share. And to the point about this would be forever going forward, the one qualification I would add to that is true because it is an amendment to the Green Book, so it's affecting the law moving forward. But the concept of excess spending would go away if the contingencies for Act 73 are met and the foundation formula is codified. Because at that point, you would no longer have ed spending, you wouldn't have excess spending, you would just have a foundation formula. So if while this is in perpetuity, if the contingencies are met, technically, the only fiscal year this would affect would be FY28.
Okay.
The bill itself, Section 1 is speaking to the last point that you guys were just discussing. This update to the definition of education spending, which is pulled into the excess spending calculation. And as you can see at the very bottom of the page, it's striking that temporal limitation, the cutoff date of July 1, 2024, and just saying outright that voter-approved bond payments for principal and interest will not be included in net spending for purposes of calculating excess spending, which means you're not subjecting to double taxation dollars that go toward that.
And are you allowed, I guess this is similar to the question about, is there a dollar threshold to get voter approval? Or is there also any regulations on what you can spend bonded money for or voter approved? Yeah, bonded. So can you bond for educational expenses? Could you vote for a bond to pay your teacher's salary?
I will come back to you with answers on these. It's not the way that I've understood bonding to be used in these.
I know, but you might want to avoid the excess spending. Right, is it a
You'd
loophole?
acquire all this interest.
Yeah, but you would have to pay excess. If you're double taxed, maybe the interest is worth not paying twice as much on your tax.
It's interesting. I mean, it's sort of an unintuitive. I get what you're saying from an incentive.
I don't know if anybody would do it, but you might want to think about it.
But that raises the question. So for school buildings, there is no definition of that? So if somebody wanted to do a community hockey rink and they had it owned by the school, is that in or out?
I think it's the other way around. You can't, well, you mean, can you transfer school property to
Have the school
municipality?
build the
Or
hockey.
The school, if they built a hockey rink,
On the school
I would,
property.
yeah, I know we couldn't do it the other way,
Yeah.
because that was a big discussion, with Act one of them.
I get it.
60, but,
Right. There are laws that prohibit use of municipal
right.
to bypass the school district itself and use the municipality for educational purposes. And similarly, there's a reciprocal prohibition in the other direction. So you're using the school district for educational expenses and you're using the municipal for municipal expenses. That's the current law.
well,
Right.
I had communities go back and forth with these things, and the sports facilities are
Yeah.
what they've gone back and forth with. And
They could be dual, like the
Right.
school could
Yes.
build a gymnasium, but then allow the community to use it. So it'd be used for educational purposes
That's-
during,
and
8 to
that-
3,
and
but then
it's
after
been-
that-
That's been mostly done in hockey rinks.
and then if you bonded it for, as long as you used it for educational purposes, it would be exempt.
But that doesn't mean we can't use it.
You could also allow the community to rent it or use it or,
Yeah,
but that's,
Right. And just to be clear here, that you're still paying for,
yeah.
right, it's just that you're not being subjected to double taxation. So in any event, the school district is internalizing the cost of the facilities it builds. It's just at what rate does it do that? And what this is saying is typically there's an incentive provided through the excess spending threshold, a compression to ed spending. The thinking is that it reduces spending because you pay double taxation on those extra dollars above the threshold, right? So this is just changing that for construction costs.
And that double taxation is the way the existing excess.
That's exactly. And so the modification we see if we jump to section 2 is to the threshold itself. As you can see in existing law, this is what Julia described, excess spending is the per pupil spending amount plus capital construction reserve funds. There's a certain temporal limitation there. After 5 years, funds in reserve fund that haven't been used would be applied to your excess spending, but your per pupil spend that's in excess of a defined threshold. In existing law, that's 118% of the 2025 average district per pupil spend adjusted for inflation. And the bill that you see here is lowering that from 118 down to 112%.
What did you say about the 5 years?
For the capital construction reserve, that's the call out you see for 24 VSA 2804. If you have unused funds that you're putting into a capital construction reserve fund, and I believe the cutoff is 5 years, those are required to be applied.
So could you put it in a different reserve?
Technically under this language, yes, right?
So for capital construction, but if you just have like a rainy day fund reserve.
And this is an ongoing question as well, is uniform usage of reserves across the state. We don't really have a uniform practice for how reserves are treated for school districts. So it's something that there's an ongoing effort to try to address. In previous years, there's been tasking AOE with rulemaking on this front to try to create reserve guidance, but that's still in the process of development. But the change here, decreasing from that 118 down to 112%. And then kind of the biggest unique thing to this bill is what you see on page 3. This is the hold harmless provision that Julie was describing. A school district's excess spending is 0 if any of the following conditions is met. The first two are the flat spending, is the way that this has been described. If your ed spending, so that's your aggregate spending, isn't greater than the preceding year. So imagine, for instance, what this might protect for is, let's say you have the same ed spending as the preceding year, but you have a decrease in weighted students, so your per pupil spend increases. Even though your per pupil spend increased because your ed spending at the aggregate level was flat or didn't increase, you would not be subjected to the excess spending penalty. Similarly, under subdivision 2, if your per pupil spend was flat or didn't increase, then you wouldn't be subjected to the excess spending as well. So you can think of that as, if you had an increase, this isn't the only instance in which this would apply, but just intuitively, if you had an increase in pupil count, so you maintained the same per pupil spend, but your ed spending at the aggregate level was greater, even though you exceeded the excess spending threshold, you could still avail yourself of this hold harmless. So those are the first two kind of flat spending exclusions. And then the third is a more discretionary piece that the chair had asked about, which is that if the Secretary of Education, with the advice of 3 business managers and 3 superintendents selected by the Secretary, determines that the increase in per pupil spending above the threshold was for good cause or beyond the district's control, that would be excluded from the excess spending penalty. And examples of those things you can see on lines 11 and 12. Emergency capital expenditures or substantial loss of pupils or offsetting revenues. I will say that this language, good cause or beyond the district's control, that grants the Secretary a good bit of discretion, right? The examples are included to try to provide some sense of what the legislature is indicating constitutes good cause or beyond the district's control, but just note that it is a substantial amount of discretion for the Secretary, and this is the full extent of the process built out. Obviously, this presupposes for the Secretary to make that determination that the Secretary would have been provided the information on which to make that determination. So it doesn't spell out the process by which a school district would do this, but for the Secretary to give your district anything, you would need to provide that information. So that is the full of the bill. Those are your 3 exclusions from excess spending. Take effect July 1, 2026, would apply FY28, and if the contingencies are met in Act 73, that'd be the exclusive year in which you have this change, and then you have an update to the title, which...
Right. Okay, so would the Secretary of Education or did AOE testify about the process they would go through? Because they could easily get 35 of these
Sure.
requests. Right?
I don't believe so. I wasn't always in the room for the, I wasn't always in the room, but I don't think that they did. I will just say this language, specifically the 3 business managers, 3 superintendents, and then use of the words good cause beyond the district's control. That's the language that has been used in the past. I think it was Act 127, the tax rate review process. That's what was contemplated. That same language was used in those contexts. It was in a different context because it was about providing cent discounts to folks' rates. But at least those terms, good cause, beyond the district's control, are something that have been addressed before.
Sarah Watson?
Thank you. So I suppose in the spirit of good cause, one of the things that I have a lot of concerns about in terms of when people talk about flat spending is that, when people, it sounds nice and it sounds easy, like, oh, it's not increasing, but really, as long as you're accounting for inflation, that's really a cut. And so, and it's an arbitrary cut based on however much inflation actually is. And so knowing that we don't generally adjust things for inflation, I will just say that I have concerns that when you say, that you're held harmless if you're not, spending anymore, if the dollar value doesn't go up, we're talking about nominal dollars, right? That we're saying as long as you have cut by the rate of inflation, assuming inflation continues upwards, that's okay. And
Well, we're not saying it's okay, we're just saying you don't incur a penalty.
right.
And you can still raise your spend by 112.
I think it's important to say that the context in which this is meaningful, the flat spending, is only those districts at the threshold, which is the point that you're making. So it's not all districts needing to make a determination of whether to hold flat, it's those at the threshold.
Right, and I'm just saying because it may not affect that many districts, but I guess, my point is that it's wanting to be clear between holding it flat versus the spirit of holding it flat. Like, we didn't add any programs, we didn't do anything new or different. We're just trying to keep, service level the same, that constitutes a cut. And so, it may end up with, sorry, I get a little fiery about this.
But-
So anyway.
But again, if I understand what you're saying, the bill allows every district to increase their spending without penalty.
Up to.
It's just if you increase it up to here, there's a penalty. And one of the ways that you can make sure you don't get a penalty is if you're spending the
Right.
same.
The complication to that is that if the amount by which you increase, the threshold is tied to the FY25 historic spending. So if you were at the threshold last year, then you can't increase your
Right.
spending, right? Because you're already at the threshold. So
So we use 25, and then that's what gets,
the threshold is determined on the basis of an inflated FY25 statewide average per pupil spend. Yep.
Anyway, I'll just say I would love to see just a little bit, but I also understand that that's not normal. That's
you
something
mean
that we do.
like it was, like when it was 118%, like a bigger delta between.
Well, that
the
would
excess
certainly be
penalty.
my preference too, but even just as we're comparing it, what is to keep with the spirit of, that it was held flat, or,
Sure.
what do we mean by that? Is that we didn't add any new programs this year? We didn't build out anything. We tried to keep it restrained, but even with keeping it restrained,
You could
with
go-
factors outside of our control,
So-
which gets to that.
Exactly.
So-
So that's what I was gonna say, is that Senate Finance did include the safety valve of subdivision 3 for instances like this, where the district is doing everything that they can to keep, I can't say what determination the secretary would make, but the language that you just used was beyond the district's control,
Right.
which is what this is intended to do.
So inflation potentially could be an example of the kind of thing that they could say, you have done everything you can to hold flat. Nonetheless, it's more expensive. So I guess I'm saying that also in case there's any question about legislative intent.
Sure.
Like
And I
that
think
could potentially be
inflation
used.
should drive all schools' budgets. I mean,
Sure does.
Yeah.
Well, it was inflated, right? The 25.
Right, what
It's
the
also the
excess
average.
spending threshold will be is impacted by inflation. Yes.
but it's the excess of the statewide average,
Yes. Which is inflated.
which every year you would think would go up just because of increased spending. regardless.
It will be increased by the inflator each year, assuming you have inflation, which I think we can safely assume right now, so.
So it's not the statewide average, it's the statewide average in 2025.
That's correct. It's dynamic in the sense that it reflects inflation, but it is not dynamic in the sense that each year's excess spending threshold
Like there
reflects
could
the
be a-
prior year's statewide average.
Because otherwise all the schools could just agree to go up. Just slowly raise it all, right?
Wait,
Yes.
sorry, now I'm confused. So if we didn't do a foundation formula, which would then take over and make this irrelevant, then every year is compared to 2025,
That's how it currently is.
and it couldn't be more than basically a 12% increase.
But it's the FY 25 inflated formula. So
Okay,
inflated
okay, there
with every
is.
year.
Okay,
But your comment about it making it moot if X one,
we have a
X
foundation.
73
Yeah.
goes through, is that true?
there would be no such thing as excess spending at the point that the foundation formula is rolled out. So if Act 73 happens with contingencies met, the only year to which this would apply is FY 28.
So, because we call it something else than Act 73.
Yeah, each district now would receive an educational opportunity payment that's purely a function of its student count multiplied by the base plus any categorical.
But
Or you
don't
could add a certain amount of locally raised.
Exactly, and there's the possibility to spend above up to a
Is there a name for that?
supplemental district spending.
Supplemental district
But
spending?
and I know the answer to this, but it is clear that if this goes into place, it will be in the green books. And if we failed to do anything, this goes on.
Exactly, so I will say that it was an intentional drafting choice on my part to draft this in a way where it is amending the section going forward. It is not just I would put it as a session long provision that it was intended to apply exclusively to 1 year. I think the thinking here was the initial bill was addressing FY 28, FY 29, and was meant to signal there's going to be cost containment pressures, as I understand it, for the foreseeable future, with the idea of bridging to Act 73. And this is saying, this is the signaling, there's cost containment. If the contingencies are met, that's it. You've transitioned to the foundation formula, and there's that kind of cost containment provided naturally through the foundation formula. But in the absence of it, this is the law. This is an amendment to what constitutes excess spending.
Okay. So,
I would also say that giving the secretary emergency, I look at Burlington and say that was an emergency and they moved out. If a school had a fire, and I'd want them to have some ability to be able to move and do things.
yes, Senator Watson.
I have some further questions. So relative to 2025, again, if no foundation formula happens, then let's say a school district is increasing their spending above inflation by 2% over time, over years. So eventually, in 6 years, you would get to a point where you're just over every year.
If you're saying that someone is growing beyond inflation plus situated beneath the threshold, yes, if you assume that they continue to grow at a higher rate, eventually they would reach a threshold. That is,
And they would just have to, right, okay.
They get
I mean-
double tax.
We have an excess spending penalty in law now.
Okay, okay.
And it affected 6 districts or 5 last year. So this is not new. This has been a tool that's been in use for years.
Mhm.
It's just, this is adjusting it down somewhat,
exactly.
but much less than the spending caps in the original bill in terms
Yes,
of what they save.
yes, this is certainly more flexible in terms of allowing spending than the
Yeah.
bills.
More questions?
Yes, Senator Watson.
Sorry, thank you. In terms of factors outside of the district's control, I just want to explore, so things like healthcare costs going up. Was that a part of the conversation?
I think that it came up. I mean, I think this line of questioning, which Senator Westman also was going down about the fire, for instance, is a great line of questioning. The extent of direction that I can provide is literally just the final clauses I read, which to Senator Westman's hypothetical, I think is called out in the examples. Healthcare is not called out. It is something that has come up in every discussion I can recall around cost containment in these. I can't tell you what the secretary would determine.
Weston, did you have another question?
She gave the numbers of hypothetically, it was 12 school districts? And if this was in place, it would be 30 something?
Yeah, so this would be if S220 were to be implemented in FY 27 using the current budget estimates that we have, which are not final. There would be 10 school districts that would be hitting the excess spending threshold this year, or in FY 27, and if that were to be lowered to 12%, it would be 33 districts. That said, I do want to raise that the amount that districts would be falling above the threshold really varies. So for instance, we're seeing in FY 27, one district that would be falling above the threshold by less than $1, while other districts would be falling above the threshold by a lot more than $1.
And correct me if I'm wrong, Julia, but excess spending penalty works like any penalty, like a speeding penalty on the highway. Its main value is keeping districts voluntarily staying below it, so that 30 number would come down arguably dramatically once it became law and people knew about it. Their budgeting for that year would take that into account in the same way that they did this year with the 112.
And
Yeah, I think that from JFO's perspective, we don't know how school districts would change their budgeting practices based off of a different excess spending threshold. We have heard testimony that school districts look at the excess spending threshold and when putting their budgets together, the field would need to speak to that. And I guess what I would say to Senator Ruth's point is those 33 districts, which is about the 21 million that would be above the excess spending threshold in FY 27 if this were to be implemented now. I think it's fair to assume that probably it wouldn't be 21 million over the excess spending threshold, but it probably wouldn't be zero, right? Like some school districts might try to bring their spending down below that, others would be double taxed.
And is the double taxation on just the excess?
Just the
Yes.
amount over the threshold.
Right. Some of them might be over, but it's $800, so they're not going to care. So it's not the number of schools, but the millions of dollars.
And some additional context that may be helpful is that sometimes we talk about these things, and I think that folks may have the perception that there's additional revenue generated, but this is a self-leveling thing. So the effect of having increased excess spending penalty is to decrease the other rates that.
So unlike in the other thing that we're doing in 73 that I always forget the name of,
Supplemental district spending.
supplemental, you need to come up with an acronym for it. So that goes in, I think we said that would go to like school construction or something, or that was talked about.
It's now used to reduce following year statewide tax rates.
Same as this. What happens with the current?
In excess spending, this is actually used in the budgeting for that year. So it's not saved for a following year. It's in that year reducing.
Okay. And my last question is the New England Economic Project Cumulative Price Index. Do you want to say anything about why they chose that?
That is the old. It's a good flag because generally we've been updating these for NIPA and we've done that moving forward, which is the regular Title 16 inflator that we call out. I think at some point there's going to be an effort to try to make uniform the inflators we use, but just waiting on a little additional information on that. So I would expect that to be addressed in the House, assuming that this has some.
Okay, so what's the other index?
NIPA, I don't actually know the national, I know it's for local consumption expenditure, yeah.
Yeah,
Is it more
state and
related?
local government expenditure and
Okay.
gross investment. It's used to look at essentially like the purchasing of state and local government.
So it's more connected to the spending that schools have,
The
the
highest
expenses.
share of the inflation of the deflator is personnel costs, so salaries and benefits.
Right.
And that's
Transportation, we have an inflator for transportation costs.
exactly. And the NIPA is the one that we regularly have used in Title 16 and that you'll see scattered throughout Act 73. But I think it's it's a policy choice which inflator you use. So I think there will be discussions either this session or upcoming about best inflators.
Should we change it now? We could put an amendment on. If you want.
I mean, you can do what you want. I'm just telling you that people will think about this. So whether you guys want to be the ones to do it or not.
Right. Well, I will entertain either a motion to change the index, or we can trust that that will be changed later and to move the bill favorably, either with that amendment or not.
I would move the bill favorably, leaving the question of the inflator to the House.
Got to give them something to do. Any questions, discussion on that motion?
Well, I will say, I have concerns, but I am also still learning, obviously, so grateful to continue to learn. I'm gonna vote yes right now, question mark for the.
My concerns are with some of the guidelines and guardrails in the bill, not with the numbers per se.
Okay. With that, the clerk shall call the roll.
Senator Baruch,
Yes.
Senator Brennan, yes. Senator Lyons.
Yes.
Senator Norris.
Yes.
Senator Watson.
Yes.
Senator Westman.
Yes.
Senator Birchlick.
Yes.
Reporter.
Does the sponsor want to report it?
I'll report it, sure. I'm just glad we started with our quick bill.
Aren't you the reporter for education and news?
Not an education.
Okay.
Did you just share it in the morning? The education meets right now.
Thank you guys.
Thank you.
Did we post? Oh, you weren't here either.
Uh-oh, what happened?
Oh,
I see
the
what
first
you
two
mean.
bills.
Oh,
No, you weren't
did
here.
we do
Three of
those?
us were. What did we do with the first two? Postpone.
Libraries is postponed. Economic development, we will do it some other time, hopefully today. So we have Lunch Council here for 325.
Okay.
So we will take that up.
Hi, Ellen Tchaikovsky, Office of Legislative Counsel. I'm here on S 325, which is called Studying the Creation of Model Bylaws, but it's actually the Act 250 bill. How much would you like to hear about the policies in this bill?
Really just the fiscal impacts of the policy. You can quickly tell us the section, like what they're doing, and
Sure.
but mainly focused on the policies.
So
Is there a fiscal note for this, or is this one of the ones that we don't?
So I did request a fiscal note on this, we do not have it, so
Okay,
while we're going over it today, would love to not vote on it today if possible.
yeah, okay, so we'll just get the overview of the bill today. Tomorrow, we'll look at, or tomorrow or Friday,
Yeah.
we'll have a look at the fiscal note and vote on it then. Okay, continue.
Great, so draft 6.1 was voted out of Senate Natural Resources. The first few sections extend most, if not all, of the dates that were established in Act 181. So there were a number of temporary or interim housing exemptions that were created in Act 181. All of those are being pushed out. So now the Priority Housing Project is being pushed out till January 1, 2028, and the other interim exemptions are going out until 2030.
Are there any dates that didn't get extended?
I don't think so, but that's why I didn't,
Okay.
I don't think so, but there were quite a few dates in that bill.
Sure.
Additionally, in the first section, the implementation of the road rule, but the road jurisdictional trigger is being pushed out to January 1, 2030 as well as giving additional authority for the Land Use Review Board to make different decisions about the number and the circumstances of when Act 250 criteria are used for both the road rule and Tier 3. Tier 3 is also being pushed out until June 30th, 2028. There are some changes related to Tier 1A in its administration so that municipalities do not have to enforce existing Act 250 permits. The board and ANR will retain jurisdiction over those in Tier 1A areas. There is a new report on how to reduce the negative impacts of discretionary review of
Can you
housing.
just tell me what sections you're in?
I'm already up to section 10. And that's the report from the Department of Housing and Community Development to look at what are the barriers basically of discretionary review of housing projects, which is what municipalities typically do in their permitting process. The next couple of sections, starting with 11, make amendments to the regional planning process to streamline the regional plan amendment process, including Tier 1B area updates, so that there will be fewer public hearings required, and that Tier 1B area requests can be made separate from the regular regional planning process.
So there still is that review.
Yes.
You're just changing the number of meetings.
Yep. And then there are a couple of changes after that for consistency under the state community investment program, which is the new name for the downtown designation program, which are in sections 13, 14, and 16. There's also a session law provision that extends any municipal plan or regional plan that is set to expire this year, extending it to December 31st, 2026, so they have additional time to update their plans before they expire. That's section 15. And then, yeah, some more additional conforming changes for the downtown programs in 16 and 17. And then that brings us to section 18 is a small clarification for the downtown and village center tax credit program. So with the update of the downtown designation program, new town centers are now part of what was the downtown designation previously, which may make them eligible for the tax credits under the downtown tax credit program. However, some of those tax credits are for historic buildings only. And buildings in the new town centers are technically not young enough, or technically are too young. They're not old enough to qualify for the historic tax credits. So there's some additional clarifying language in section 18 that says that those that applications for the tax credits are only for those eligible buildings eligible to be listed on the Historic Places Register, the National Register of Historic Places. And then finally, section 19 is the effective date. Sorry, it's not the effective date, it's the appropriation. It's the appropriation. So there's two appropriations in this bill. So first, section 19, subdivision A, there's $200,000 from the general fund to the Agency of Commerce and Community Development to develop additional model plans as part of the 802 Homes program. I don't know if you've heard about that before, but the agency has been working with consultants to develop model home plans that can be adapted and used by builders to help them go through.
Like architectural plans of the homes themselves.
Yes, to help them go through the municipal review process very quickly because they're sort of pre-vetted to align with municipal zoning requirements.
And they want to make more of those plans, like different homes or something?
Yes. And then, I don't know the details. Are there 10 existing? There's 10 existing model plans, and they would like to do some additional ones. The second appropriation is $100,000 from the general fund to the Land Use Review Board to conduct public engagement and education on Tier 3 areas.
Okay.
And then there's an effective date and changing the name of the bill so that you all know it is related to Act 250 and regional planning.
And the public engagement is particular to something that happens in this bill around Tier 3? Or is it just the Tier 3 that was supposed to be done on 181?
So just in general, so this is one of the requests that we heard, for example, from the Rural Caucus, that especially in places that, tier 3 may have more effects, that there just needs to be more education and outreach about what the bill is, what it does, and then also to engage with stakeholders about how to make it work, particularly for folks that it might be affecting.
It is tier 3.
Tier 3, yeah.
Okay, and then I have a question for JFO, but maybe council knows too, like, does somebody have to request a fiscal note? Or will a fiscal note be created if there is a fiscal impact? Or a legislator has to say, I want a fiscal note.
For the record, all 911 joint fiscal office. Fiscal notes aren't automatically done. Most of the time, like in committees that we staff regularly, we know fiscal notes need to be done. Bills coming off the wall, or it's going to pass. For a committee like yours, where we're not regularly staffing it, it's good for you to let us know, because we won't just know.
Because you wouldn't know that this appropriation was in there.
Sometimes what happens is that the clerk or the whatever,
Committee system.
secretary will refer to a committee and will go, oh, needs fiscal note. So we sort of rely on chairs and committee members for the committees that we don't staff regularly to inform us.
And so I did send an email yesterday, 2 days ago, like that I started with Catherine Benham, and then I believe it's Ted Barnett who's going to be drafting the fiscal note.
Crazy.
So,
Okay.
yeah.
You have a question?
Probably shouldn't get into this. But the 100,000, will that make maps available so counties like mine that haven't seen the map will be able to see it?
So that's a good question. The maps, as they are progressing, they've been changing over time. So the next iteration of maps is supposed to be due out in April, and theoretically they're available to anyone. But this appropriation, the intention would be to do outreach to make sure that people are aware of them, and also, I mean, we actually use the word engagement on purpose rather than just education and outreach, because we wanted people to also give us feedback.
Are the maps being changed by the
land use review board
as they go through the process later on Act 1?
Yeah. So they're not finalized, they're not done, and every iteration that they've been through, the area actually has shrunk every time. I think there was one iteration that covered the entire town of Woodbury, right? that doesn't work. And it's continued to shrink, and as they're hearing feedback and understanding how to best address their mission, really, of protecting critical natural resources. I think they've been able to sort of winnow the areas down.
And are the maps available on their website, I would assume?
Yes. Well, actually, I shouldn't say that for sure. Let me go confirm. They should be. I know they're out there and people can look at them. But I should confirm where they are.
Okay. Any questions about S325? We're not going to vote on it. We're going to wait until we get fiscal note, but we're hopeful to do that tomorrow. Thank you.
Okay.
So we now have our lunch Councilor Kirby here to talk us through S154 and S9 and 190. Do you want to start with 154?
We're voting on this at all?
These two we're hoping to vote on. The bill we just talked about, we're going to wait for the fiscal note. We vote for it on tomorrow or Friday.
Okay. Good afternoon.
Thank you for joining us.
Sure. Jen Kirby from the Office of Legislative Counsel. Remind me, or do you like language up on the screen? If I have it, or?
Yeah, it definitely.
Right, no, you should have however joined your Zoom for me now. Great. Yeah, I can share. Perfect. Thank you. All right. Oops. All right, 154. So this is,
There's no fiscal note for 154.
There is.
I believe,
There-
yeah, one of them.
Yeah, there is.
Yes, there's one for each.
Okay, for both.
I might not be here though.
You may not be here?
They're both here.
No, I'm saying if you have questions, but I have about 7 minutes.
All right,
Okay,
we'll do this
do we
one
wanna
quickly
do
so you
the-
can ask Nolan for information.
Do we want to do the fiscal note first? Is that okay with you, Jen?
It is, it may not have context.
Why don't you have Jen go through?
Okay.
This one, I think, should be pretty quick to get to the fiscal note issue. So this is S-154, an act relating to health insurance coverage for biomarker testing. And as it recommended by the Committee on Health and Welfare, starts with definitions, but basically it directs the Department of Financial Regulation and the Agency of Human Services to analyze the costs associated with requiring health insurance coverage and Medicaid coverage for biomarker testing for purposes of diagnosis, treatment, appropriate management, and ongoing monitoring of a patient's disease or condition when the test is supported by medical and scientific evidence. And then it talks about what those might look like, that evidence might look like, and then report by January 15th of 2027. First, we have DFR reporting to the policy committees on the estimated amount that health insurance premiums would increase if the state were to enact legislation requiring health insurance coverage of biomarker testing, including the amounts, and there would be costs to the state if we were to enact the mandate. So not, I'll defer to Nolan on whether there's cost to do the report. But there are a couple of pieces that would have a state cost. One is that the state is required to pay for any increased premium attributable to a new insurance mandate. This is under federal law, so the state has to what's called defray, state defrayal, the cost associated with the increased premium for qualified health benefit plans. That's a federal requirement. Also, the state would have to pay for premium increases in the state employees' health plan. And then separately, this asks the Agency of Human Services to report by the same date on the approvals that would be needed from the Centers for Medicare and Medicaid Services. In order for Vermont Medicaid to cover biomarker testing and the costs to the Medicaid program if we were to enact legislation requiring that coverage. So again, this is looking at finding out how much it would cost and what would be required for Medicaid coverage. But as far as the bill itself, I will defer to Nolan to talk fiscal note if you want to.
And here is the fiscal note.
I don't know if it's on the website, I can pull it up with
Yeah,
it.
go pull it up.
Great.
I mean, we all have it, so you don't have to pull it up.
Okay.
And it's on our website. It's control.
Anyways, you want to go through it.
For the record, Noel Langwell, the Joint Fiscal Office. As Jen said, it requires DFR and NHS to analyze the costs associated with requiring health insurance coverage and the Medicaid coverage for the biomarker testing. The issue is that the bill would require the analysis that's required of AHS. They could be done under their existing actuarial plan design contract, so they already have contracts with these actuarial firms to look at plan designs for the qualified health plans. So they can do that within their existing contract as long as it's not robust. That said, DFR, however, the way that they pay for their actuaries is through what's called bill back. So they bill back, so if they're reviewing a Blue Cross Blue Shield plan, they can then go ahead and bill Blue Cross Blue Shield for the time they've spent regulating that. This is outside of that because it's not a regulatory thing. It's like, go do a study.
Yeah.
So for something like this, they would actually need an appropriation because they can't just bill, because the way it works is the actuaries bill them for the time that they spend on those particular things. I mean, long story short, for this kind of thing, DFR can't use their bill back authority for this
They
study.
didn't testify asking for money or.
They didn't testify, they just told me we don't have the authority, if you want this work to be done, they need an appropriation. That's what they said too. That they don't have they don't have it in their budget. They just
They didn't say what it would be.
did not.
Okay, so right now, it requires them to do the study, but doesn't provide them any funding.
Yeah, they're saying they need resources.
Okay. Well, since there's no resources in here, we don't need to take them out. And then if somebody else can maybe have that discussion with DFR. Senator Westman?
This, we'll get there.
Okay. I mean, if this is here, we
Bill, my hospital's trying to get a hold of me about.
no, I think you're talking about S-190, I think.
Oh, okay.
Yeah.
Yeah.
No, we're talking about-
There's just enough for that one,
Talking
too.
about something?
Yeah, this is just about
190.
biomarker testing.
Okay.
So that's the rub on this
So
bill.
DFR will come back and say, based on our analysis, here's what the cost would be it would be global commitment.
They haven't given me a number of what it would
Not
be.
for the study, but give us a number at some point in the process, the bill's gonna pass about what it would cost to do the study, but the study would tell us what the cost would be.
Correct.
For our match for Medicaid.
It would tell us what the impact on the insurance markets would be and how much the state would be on the hook for defrayal.
Right.
It wouldn't tell us about global commitment. That's.
But it would have an impact on global.
It would have impact on global commitment to the extent that we require Medicaid coverage.
Right.
That would be
Right.
a different thing. And I think to get there, I mean, that gets the whole, like, AHS has to look at, like, state plan amendments, right? So they can't just go and do it. They have to get a state plan amendment. So this would say, this is what we need to do to get a state plan amendment. The problem we run into with Medicaid is that, one, it's unlikely that we're gonna get any state plan amendments under the current circumstances. And B, global commitment ends in about a year and a half, so it's not necessarily worth the time to go put a state plan amendment, that by the time it's approved, we've only got 5 months left in global commitment. It becomes more of like, can we include it in the next waiver?
Right.
Which we don't even know what that's gonna look like. So
Okay.
they're gonna look at that, but they'll come back and tell you what the pros and cons are. But it's not like we're gonna, you don't have to book Medicaid match for this service at this time,
Right.
or
Okay.
even next year potentially.
Okay. Any questions? Mr. Nolan? Okay.
Everybody knows what biomarkers are, well, cool.
I don't think we need to
We
know.
all need to know.
I'm gonna need to know.
We had an
I need
We
to
did,
know.
we chatted ahead of time.
Okay, so the bill has been moved favorably, I assume?
Yeah.
Our vice clerk has to, you're back on the ballot.
Uh-oh.
The vice.
You don't vote anymore. You're done.
I'm disenfranchised.
You're done.
So there's no appropriations to this?
There's no appropriations in this at all.
Vice clerk.
And DFR is likely to request an appropriation, but they could request that when it gets to the House. Or maybe they'll bring it up to the governor. Or they'll find the money in their budget under a couch cushion.
Go ahead, start.
Bruce, yes.
Brennan's gone. Lyons.
Yes.
Norris.
Yep.
Watson.
Yes.
Watson, yes. Perchler.
Yes. He hesitated. Good job. The reporter of this bill.
Oh, I can do it. It's in my.
You know that bill. Okay. So that was success on S-154 biomarkers. Now we're going to S-190. Same, Councilor Carvey will talk to us about that. Here is the fiscal note on S-190. I also have S-190 printed out today. We got a lot of printouts today. So this is the amendment.
No, you have to remember.
I have the amendment.
Cool.
He has
That's good.
his amendment.
My amendment, not your amendment.
Oh, my
You
amendment?
have an amendment.
No, your amendment
I
has
don't-
been active while you've been on the floor. I don't think you have a consensus, so
Oh,
Yes.
I don't know if you've seen the
Do you want to wait to
I
vote on
haven't
the
seen
bill?
my amendment since I looked at my amendment this morning.
Well, there's
Okay, we'll
stuff in
talk
your
later.
email.
Well,
Is
okay.
there, is this an amendment you want the committee to consider or that you would make as a floor amendment?
I think it will be somewhere.
Or your committee to that?
Yeah, our committee will probably.
Okay. So tell us about S
All
190.
right, great. Again, for the record, Jen Carby from the Office of Legislative Counsel. This is S 190, as introduced. It's an act relating to the Green Mountain Care Board reference-based pricing and hospital outsourcing of clinical care, although the name is proposed to change at the end of this amendment. So it deals with several different sections. The first, or provisions, the first is on reference-based pricing, which you may remember was enacted last year to direct the Green Mountain Care Board to work on reference-based pricing and using percentages of Medicare rates. This would add language saying that for provider contracts entered into, amended, or renewed on or after October 1st, 2026, hospitals and health insurers need to start expressing as a percentage of Medicare or another benchmark if the board decides another benchmark is appropriate, the rates for items and services identified pursuant to a collaborative process between the board and representatives of Vermont hospitals. So provider contracts are going to start using Medicare percentages to indicate the percentage of Medicare that the prices are, that the rates in the contract are set to. Also, when making public the charges for items and services as required by federal law around hospital price transparency, each hospital has to include in its machine-readable files pricing information, again shown as a percentage of Medicare rates, as well as in dollars and cents, disaggregated by payer and by plan. And then it specifies that for purposes of these two subdivisions, a hospital may express its rates as a percentage of Medicare based on the actual reimbursement amounts that the hospital receives from Medicare for items provided and services delivered to Medicare beneficiaries until such time as the Green Mountain Care Board adopts a rule establishing the methodology for determining Medicare rates for use as a benchmark in establishing reference-based prices. That last part is all a long way of saying the hospitals right now get different Medicare rates based on various factors having to do with what type of hospital they are and other things. And hospitals don't know what the board is going to come up with as sort of the official Medicare rate for on which the reference-based pricing will be based going forward. So until the board has developed that, hospitals can report their rates as a percentage of their actual Medicare reimbursement. So the information that they have. That's what this piece is saying. It also requires hospitals to apply for, obtain, and use a unique national provider identifier on claims filed after October 1st, 2027, for when they are paid for items provided and services delivered at an off-campus department of the hospital that's different from the one used for the main campus, so that there's better ability to track where services are delivered. And this uses a federal definition of campus, and off-campus is a facility located more than 250 yards from the main campus. Section 2 has limitations on hospital reimbursements. This piece is still, I think, in a little bit of flux, but as written here, this is going to provide a cap on how much a registered carrier, which is a health insurer offering plans in the exchange, so how much an exchange plan carrier can reimburse for hospital services. That cap is 250% of the, as written here, Medicare adjusted base rate for items and services for enrollees in qualified health plans. And it's got some carve-out language around non-fee-for-service bases. The reimbursement limit would be in place until the applicability date of the Green Mountain Care Board rule establishing reference-based pricing more broadly. It prohibits hospitals from balance billing or charging or collecting from the patient any additional amounts other than the authorized cost sharing under the terms of the health plan. And the language requires the Green Mountain Care Board in its rate review, health insurance rate review for qualified health plans, to ensure that these limitations on reimbursements are appropriately reflected in the premium rates, meaning these caps on reimbursement for hospital services in qualified health plans should show up as a reduction in premium increase for the qualified health plans. Are you ready to move on?
Yeah.
All right. Section 3, make some changes around hospital budgets and budget review. Adds a definition that matches the definition in the previous section for Medicare adjusted base rate. And then adds a new section on targeted commercial reimbursement rate reductions that directs hospitals to implement any commercial reimbursement rate reductions that the Green Mountain Care Board orders through their hospital budget review process. Through its limitations on commercial reimbursement rates, that 250% of Medicare rate cap first. So if a hospital is directed in the Green Mountain Care Board's budget order to reduce its commercial reimbursement rates, the first place that will show up is in the rates, the limitations on the hospital reimbursement for the qualified health plans. If, to the extent that a hospital is required by the budget order to reduce commercial reimbursement rates further than just what can be achieved by that 250% cap, then the hospital would reduce its commercial reimbursement rates that exceed 500% of the Medicare adjusted base rate, or if it doesn't have any rates that are exceed 500% of the Medicare adjusted base rate, then by reducing its highest commercial reimbursement rates in relation to the Medicare adjusted base rate. If a hospital can show the board that the limitations on its reimbursement rates, either for the 250% cap for the qualified health plans or otherwise under this section, are having a negative impact on access, quality, or the sustainability of rural healthcare services, the hospital can propose to increase the commercial reimbursement rates for one or more of its service lines, such as primary care, and the board has to consider both the demonstrated impact and the proposed increase to rates. Section 4 is where we get to the appropriation. Section 4 is the implementation, I'm sorry, not this one, further section. Section 4 is implementation of reference-based pricing for certain public employee health plans. This directs the Green Mountain Care Board, in consultation with others, to analyze commercial health insurance claims for items and services for active and retired members and dependents in the state employees health plan and in health plans offered to teachers and others through the Vermont Education.
Is that different than what the bill we passed, whatever, last year about reference-based pricing? They weren't included on that?
They weren't not included. This is looking at what happens if if that group is addressed in a different time frame than the full system-wide reference-based pricing.
That's what this they look at. Right?
That's what this is directing them to look at. So look at basically like what it costs to provide services to those in those plans, and VHI and others have to give the board access to claims data, but they're supposed to determine opportunities available through the use of reference-based pricing and the projected impact on Vermont's hospitals, and then report back in January with the board's findings and recommendations regarding scope, timing, financial impacts, and other considerations in implementing reference-based pricing for these public employees. So they had asked last year to go first in reference-based pricing, and the legislature determined to do everybody kind of equally, not pull out a specific population. Now in this bill, they're pulling out the qualified health plans and doing some reference-based pricing specifically targeted there. The public employee groups have come back and said, we would also like to be part of that. And this is saying, hold on, we're gonna look at what that would do, both the benefits to the public employee plans and the taxpayers, but also what would that do to the hospitals? Because there's concern about rolling out reference-based pricing too quickly and interfering with hospitals' ability to stay open.
Because that's what I heard, that people wanted to have reference-based pricing move ahead quicker, but this doesn't just for that one. This bill does move it quicker for one group and studies moving quicker on the second group.
Right, it moves it quicker on qualified health plans, which have very high premiums, and the chair of the Health and Welfare Committee can tell you more about that if you're interested. But yes, this does pull out one group and start doing reference-based price. Pick a percentage, which otherwise has not been figured out what the right percentage is. What to base the reference on, whose Medicare rate, what is the right reference for a particular hospital for a particular service. This is saying we're jumping in and putting 250% for the qualified health plans for all hospital services based on their own Medicare rate.
And when are we expecting the other reference-based pricing to kick in, or is it that?
Well, the
on
language that you passed last year said as soon as practicable, but not later than hospital fiscal year 2027, at least that it would start, and that's October 1st is the beginning of hospital fiscal year 2027. So
All right,
soon,
yeah, no, okay,
but maybe not as soon as many would hope.
okay.
Don't get me started.
All right, section 5 is on hospital outsourcing. And this is directing that for fiscal year 2027 hospital budgets, the Green Mountain Care Board direct hospitals to provide information that the board requires regarding the clinical services that the hospital outsources to external entities. And then on or before January 15th of 2027, the board, after consulting with hospitals and their contracted entities, and assessing the impact of outsourcing on access to and quality and availability of care, will provide findings and recommendations about outsourcing to the committees of jurisdiction. And in addition, the board, in collaboration with the Agency of Human Services, would report on the extent to which hospital outsourcing affects provider tax revenue and recommend any needed changes to those statutes to appropriately reflect expenditures for patient care at Vermont hospitals.
In these sections, if there isn't a fiscal impact, you can give us a very quick thumbnail.
All right. The next one has no fiscal impact. This is really carving out reference-based pricing from the scope of what healthcare provider bargaining groups can engage and have a non-binding arbitration process.
Okay.
Section 7, also no fiscal impact. This is eliminating a requirement that the Green Mountain Care Board have an administrative appeals process for appeals of its orders in addition to appealing directly to the Vermont Supreme Court. Everything has already
still can
gone.
appeal to the care board, or?
You can still appeal, this is requiring them to adopt procedures that provide for the issuance of a final order and the creation of a record that can be used for an appeal, and appeals go to the Vermont Supreme Court as under.
So right now, the person could, or a hospital could appeal.
There is no internal, there has never been an internal appeals process. There has been this language talking about an administrative appeal, but there is not an official.
So it's almost like a technical, or just making the statute line up with
Yes,
reality.
making the statute line up with reality.
Okay.
Section 8 does have a fiscal impact, but it kind of I think it has its own contingency. This is directing the Green Mountain Care Board to develop and maintain a public interactive tool displaying information on health system performance and update it regularly. Section 9 says, but they only have to do that if the board gets sufficient funding from the federal government or another source for this purpose. So it comes with its own contingency, and I understand the language, the funding is included in the rural health transformation funding from the federal government.
Okay.
Now we get to the piece that does have the fiscal impact. This is the Public Employee Health Benefit Authority Study Committee that would be established to develop and to look at opportunities to establish a state authority that would develop and administer comprehensive and affordable health benefits for all public sector employees. It gives membership, there's 11 members, some of whom are state employees and others. It specifies that they do not receive per diems. And it tells them to study certain topics and produce a report on the potential for establishing this authority to provide and administer health plans to meet the health and wellness needs of Vermont's municipal, state, public school, and public college and university employees and their dependents, looking at various things in other states, what the scope of coverage is in the various plans offered to these folks now. A lot of other information I'm happy to go into in more detail if you want, but it goes A through L, and provide recommendations regarding a detailed blueprint with timelines for setting this up, the need, if any, for independent consultants or advisory personnel, and the costs of creating and annually funding this authority. The report due in February of 2027 to the General Assembly and the Governor, It gives the study committee the administrative, technical, and legal assistance of the state treasurer's office and allows them to engage one or more consultants and firms. That's where the funding comes in, talks about the meetings, and then the study committee would cease to exist shortly after submitting its report, requires public hearings, requires people to provide access to information that would be needed. Members of the study committee, as I said, do not get per diem compensation and reimbursement of expenses, but it would appropriate $50,000 to the office of the treasurer to pay for the services of one or more consultants or firms. And then we have an amendment that addresses that. The act would take effect on passage.
Okay. Any questions, Ledge Council, on all that? We have it all memorized. Here is amendment that would just strike the $50,000 or say that to the extent funds are made available. So we will put it on, that's all Amy's list, which is the things that we will look at putting in the budget when we get the budget over from the House.
Yes, this.
Oh, go ahead.
Well, this is the amendment, just to put it up on the screen. It would add after that language saying the committee can hire consultants. It would say to the extent funds are made available for this purpose, and then it would strike out subsection I, which is the appropriation.
Okay.
Can I ask the chair?
Yeah.
Do you have an amendment?
I don't have an amendment at this time, but I'm working on a possible amendment. It's getting to be difficult to come to agreement on what might be in the amendment. And so as the bill passed the committee, it was 5-0-0, and there was plenty of time for disagreement and for attention to places where people have concerns, but we're trying to resolve any final questions. So I'm still working on it. I'm going to try and get to closure on that by tomorrow afternoon. Jen is my right-hand person. Is that tomorrow afternoon, maybe Friday morning? Put it that way, Friday morning.
We'll see.
Yeah.
I've heard from my hospital and they're trying to.
I'm sure you have.
And I don't know the details.
Yes.
So
Jen, would you mind describing what the issue is? Because I think that people are going to hear about Medicare reimbursement rates
Right.
and what the hospitals can and cannot do. And we've talked about it in our committee. There is from my perspective, it's really critically important to keep moving on reference-based pricing and to have some transparency about how hospitals are charging for different services. And there's a disagreement about how much hospitals can do and what they can do and what they can't do. So just.
Sure, and I'm gonna just put the language up here again, just to be able to show you what we're talking about. So this is in section 2. This is on that 250% of Medicare cap on reimbursements to hospitals for people who are enrolled in qualified health plans. And the issue is this definition of Medicare adjusted base rate, which is looking and having kind of a standardized definition across all hospitals. And the hospitals are saying we don't have that information to calculate what that would be. We only know what we, as individual hospitals actually receive for Medicare reimbursement. So they would like language put in section 2 that is similar to language that was up here in section 1, saying, hospital can use the percentage of Medicare based on the actual reimbursement amounts they receive from Medicare until there's sort of a clearer path forward on what the Green Mountain Care Board is setting for everybody's using standardized Medicare definition for Medicare calculation. So that's what the hospitals are requesting. And I think the Green Mountain Care Board has some concerns about that I've been fielding during the day.
And there is language in the bill that offers some forgiveness should the conditions for determination of the reference-based price cause harm to the hospital. So there will be some ability for hospitals to demonstrate that and for the board to say, oh yeah, we'll do it a different way. So it's not like we're forgetting hospitals for this.
Okay, that sounds like a committee amendment.
It is
from
a
Health and
committee,
Welfare.
it's gonna be interesting. We'll keep you informed on it, obviously. And, frankly, I don't know whether it's best to vote on this at this time, vote the bill out at this time, or to hold it over for Monday.
I would rather, know what, and I get a chance to talk to my local hospital before.
Well, the
Well, it
local
seems like it's-
hospital is not going to want to do what's in the bill, because they're hearing that it's going to cause harm, when the reality is, everyone will be doing the same thing, and they'll be able to identify the payments that they have with respect to a Medicare condition. It's 250% right now, but
I totally recognize that
Yeah.
something needs to be done.
Yeah.
And I
Understood.
just haven't had a chance to get back to them tonight.
Well, can we pass it out of the committee
Yeah.
with the appropriation change, then have a floor amendment from Health and Welfare?
Oh, yeah, well, I'm fine with
Because
it.
it seems like this is more of a policy than a.
It really
appropriation.
is. It really is, and it will, the more we move forward, we're very concerned about hospitals. The whole reason all of this started was we have hospitals in the red and we want them to be in the black.
And the amendment won't affect the financial, the appropriation.
I don't think so.
There won't be a fiscal impact of that.
That's your
Is that okay? Are you,
I would rather,
you'd rather wait for?
I'd rather wait for tomorrow.
Well, it won't matter. I mean, we'll put the thing in. I think let's get it out of appropriations, and then we'll work on the amendment.
Well, if you would like to wait for tomorrow, we can.
If you could, I would
I'm
appreciate
fine.
it.
Because we'll,
Either way is fine.
okay, we won't vote on this today. We're gonna try to do it. Thank you.
Thank you.
Yeah, no, because it's important that people feel good, and we have today, so might as well take it. So I'm hoping that we can do one more bill, and that is
Sorry.
327.
Sorry,
So we have
I don't, tomorrow would be good.
Rich Council here for 327. Do we not? Yep. Rick, yeah.
Thank you.
Afternoon.
This is good.
Thank you for being here.
Sure.
And you were here yesterday, right?
I was
So
here.
We got the briefings from Chair of Economic Development. So I don't know if there's anything else you want.
So Rick Sagel, Office of Legislative Counsel, she did a great overview, Senator Clarkson, of the bill. Happy to answer questions about specific parts of the bill. But as you all saw, most of the sections are allocations of money to certain departments or agencies for specific purposes. I understand there might be some concerns about that, so happy to discuss how you want to address those allocations of money.
The one question I have, which I don't know if it's a joint fiscal question or a Ledge Council, and Ledge Council question is the two tax credits.
Yeah.
Right, so there's the repeal of veggie, which has been around for a long time, and has it always been the 2.2 million, is that what it is?
So I'll defer to Pat Titterton. That was the 2023 loss of revenues of the state, but Pat may have more information about veggies past.
Yeah, so I went back and looked at, after the fiscal office, I went back and looked at several of their previous annual reports. It looks like, that generally speaking, the incentives paid are.
You want to come up here?
Sure. So from the 2025 report, 2.2 million in incentives were paid in 2020.
Do they have a cap, or they can just do as many incentives as they see fit?
They do have a cap,
10 million, 15?
I'd have to get the exact number, but the annual expenditure in that year was about 2.2 million as a tax expenditure. I think back in 2015, actually about as far back as I went, that was when the largest number I saw, which was about 4 million.
Okay. And I was just wondering about, which I asked Amy about earlier, about the role of this committee on tax expenditures. Like, we are in charge of appropriations, but we're also in charge of things affecting the expenditure, affecting the budget, the way I would see it. And tax expenditures affect the budget because it's less money that we're gonna have. But since this is kind of the veggie, I see it as like an ongoing base appropriation. But the other tax credit was changed or increased, right?
So the downtown village tax center, that's in statute, and the annual max is 3 million. Senate Economic Development raised that to 4 million. Senate Finance yesterday lowered it to 3.5 million. So that was their one amendment, was changing that downtown tax credit to 3.5.
And they did that, or did they explain why they did that?
I think it was explained to them that the program is usually over applied to, that they would normally give more of these tax credits if they could, and that it pays at the 17-1 is what I usually hear. I'm not sure if that's correct. That's what the politics of it are. So I think that over there it seemed a pretty popular program that could use more support.
But they lowered it.
Well, so they reduced it from 4 to 3.5. So it's still up from 3 in statute.
What was their rationale for lowering it from 4?
When I was in committee, I think one member, it was a compromise. Some wanted to keep it at 3. Some
the governor wanted it at 3. Well, the governor has it in his budget at 3.
Correct.
So they split it and did 3.
I will just point out that Jane Kitchell, when she was here, when people quoted that number of, you put in $1 and you get $17 back, she said, well, we should just take the whole budget and put it in this program, 'cause
we could put $9 billion into it and get $17 billion back. Yeah.
I heard Jane say this, but I also heard earlier Dave Dixon, we can't afford to save that much money.
Yeah. The other thing about the bill that I had was the wording of they're not appropriations, but they're money taken from the I can't remember the wording, allocation paid to the departments. Well, was there a reason it was worded that way?
So last year, the same economic development bill, at some point during the process, it was suggested that it be phrased in that way. So when this bill came up, I drafted the same way, with these monies being allocated. It didn't really come up in the committee, the jurisdiction committee.
And did the departments or agencies mentioned testifying to those sections?
I don't recall any testimony about that specifically.
Like, so when they came in, they said, you're taking the money that we would get allocated and spending it in the bill, but they didn't weigh in.
So personally, I didn't see any. It could have happened, but I didn't hear any of that.
Did they just not testify, or they testified and didn't mention that?
So when I was in there, most of the testimony was from, for example, Section 3, the small business supports. You had the professionals of color come in, you had the Vermont Law School come in and testify. They would be, of course, awarded this money. They would not be directly impacted negatively, right, by the allocation. So I don't have heard differently. If anyone came in and spoke about that.
Yeah, I mean, so part of some of my understanding of the language and how where it came from originally is, as Rick said last year, this was some language that was used. I believe the bill was coming out of House Commerce at the time.
Sounds right.
And at the time, it was actually coming after the budget. So the dollar figure amounts were already accounted for and passed by the legislature. So, and I think the committee's intent with this language this year was acknowledging the fact that ultimately this committee is going to be making ultimate funding level decisions on all of these, what can fit within the budget. Right. So I think the intent really was to express what they think the need is by using these dollar figure amounts, while acknowledging that ultimately that may not be viable.
Yeah, that's fair.
Yeah, because I feel like they should be consulted on some of these things. For example, the brownfield section. It takes $3 million of the money appropriated to DED for brownfield, which they don't have any other appropriation in the budget for brownfield. So maybe that's not a good example. But it takes the 200,000 for the VORA. It takes 200,000 out of the money appropriated to forests, and that gives it to VORA without. If I was the commissioner of Department of Forest and Parks, I would want to say, don't make me do this or do, like, it's not in the governor's budget.
Right. Just 200 is not.
Yeah, so we're saying the Department of Forest and Parks is gonna get the same amount of money in the governor's budget and our budget, except our budget says 200,000 of their budget has to go to VORA. We don't necessarily have to give them more money. Like, right?
That's correct.
The way it's worked, which is weird to me. But there are some, I don't know if they're all that way, or all the appropriations written that way?
In this bill, yes.
Okay.
Yes, it's all allocations. Again, coming from last year's economic development bill, that was the method that we went with.
And I'm surprised that they didn't come into economic development or finance and say, why are you taking my money?
They may not fully understood the implications of the language.
Yeah.
There's a lot of moving parts.
Yeah.
Yeah, there are.
Like again, like the law school, I might like the program to give $100,000 to law school, but it's not coming from the general fund, it's coming from money that was given to DED. So if DED doesn't like it, the bill passes, tough, they gotta find $100,000 within their existing budget. It just seems weird, the way we would word, I mean, you did the amendment, it kind of goes section by section, right? Taking those out. You just strike each section?
Correct.
Because it's like, there's no reason to, because the way the word is, you just like, we're just taking that section down.
Correct.
So if somebody reads the bill in the House, they wouldn't see those sections.
They would not see
A lot
the
of
money
sections.
or what the money was gonna be used for. Correct.
Right.
Now, if you want a different type of amendment that basically takes this language but changes it to appropriations instead of allocations, and then add that contingency section that you've been doing, that's doable, if you prefer that.
So we would like change it all to appropriations and then strike the appropriation?
Right.
Can we do that? Add sections and then strike it in the same amendment?
So, well, what you would be doing is it'd be a strike all, and you would basically replace these sections with appropriation language, very similar wording, just appropriation. And then you'd add a section at the end, that contingency language, that these sections are contingent upon funding.
Okay,
Good.
well, we will think about it. So we might ask for that. I will confer with council between today and tomorrow. Do you have a
I
comment?
think
Question?
more importantly, does Amy have the list of everything they've asked for on her tracking document? And most of this will consider within the context of the budget.
Yes, but we will be basically taking out all the sections of the bill. So the next person that sees the bill, meaning House, I don't know, economic development, would just see a bill with 3 sections instead of 14.
And I would tell them obviously what happens.
Right, yeah, and
I would say, right.
they could find out, they could look at it. Which maybe is fine, just to do it that way, where you just take out all the sections that mention the money. Although some of them are in the governor's budget. I guess they wouldn't have put it in here if it wasn't. Is there?
And maybe Pat could better explain, there's a couple that have includes the governor's recommend, like the micro business, right?
Yeah, where's your?
Yeah, so I think the only two sections or pieces where you have dollar amounts that were not, there was nothing in the GovRec putting money towards those would be the Law School Small Business Law Center and then the brownfields in section 6. So those are two pieces that the governor did not have any money in his recommended budget amount for. But yeah, so there's several others, and I can kind of go down the list.
For like VOREC, they put in 200,000 more than the governor, but by taking out the section, we're not affecting that, because they were just amending that to give them $200,000. We wouldn't be affecting the governor's rec or what the agencies wanted to do by taking out this section, right?
Not that one.
Right,
So not
and
VOREC.
what ended the other one?
But so the microbusiness on page, so I'm looking at the Senate Economic Development Report, the subsection C in section 3, microbusiness support, that 494 is the governor's rec, right? And
Yeah, 493 and 300, or $493,339.
But the governor, the budget would still have that money. Right?
yeah, and so if you look at the language, this is pretty simple, and striking the language doesn't remove that program, and it doesn't change what they can do with the base funding, right? That's 194.
Right.
Pretty sure it's base funding.
Yeah.
So I think the intent here was to say we support the GovRec plus this extra money because we disagree with the GovRec. We think it should be higher.
Yeah.
But some of the, like the Vorex, since we're on it, you got me looking at that. That 200,000 is in addition to the appropriation from the general fund, but it's also directed to a specific study, to fund a study. So that's specifically used for that, as it is. Okay. So when are we going to talk about that? Like, I personally have an issue with that.
Okay.
The use of that extra 200,000.
What section is it?
Section 4.
So this is the amendment that had drafted that just takes out the section. So if you wanted to have an amendment that changes it or changes the wording of the study, then this amendment wouldn't be helpful because this just takes the whole section out. So there would be no study, there would be no direction at all because there's no money or.
No money, okay.
So if we just want to take out all the appropriations, even though they're worded in the sort of allocated way, that's kind of what we normally do, so maybe that's just what we should do.
And deal with it in the budget.
But then we would just deal with it in the budget.
And Amy has the whole list.
Because I guess the House, even if they got it with the different wording, it doesn't help them because by the time they get it, their budget will already been passed, so they're not gonna change it. They're not.
So I'm seeing an analogy here between how health and welfare deals with some of the other requests that we get. And we go through, we have people come in and they make requests. Some of the things are in the budget, some are not, some need more appropriations, some, nobody asks for less, believe me that. But, so then we send our prioritized list here. I'm wondering if economic development has a priority for these expenditures. So maybe that's a better way for us to look at it, that's all.
Yeah, and I asked the committee chair for that, and I was, the committee did talk about it, and she gave me a list. Between the two bills, actually, priority. As I said, it doesn't help just having one bill. Do you have any comments about doing it section by section?
Documents, the most important thing.
Yes,
The language is
office.
important.
So I think so for example, the ones where there's a base appropriation and then there's an increase, if for whatever reason the House were to change the base and you were to change the base, the bill as drafted would be very complicated to track. And so sort of removing it all and then looking at it as the construct of the budget, I think is a good approach.
We just have to remember not only, for example, the voter thing, if we wanted to have, we wouldn't just have $200,000, we might also want to add the language that 327 had it or not, we could change it. But we would have, I assume your magical list not only has dollar numbers, but references to like the section.
I have references to the bill and sometimes they just reference the section.
Some of these things aren't just the dollar amount, they also want to change the program, so we'd want Good, does that make sense?
Where's look at draft 1.4 amendment?
Okay. Did you have a
Just one more
comment?
comment, just because it didn't come further, the veggie repeal is not gonna be removed in this. So the underlying bill repeals the repeal of veggie, so it lives on, right? I always get tricked on that part. So your amendment does not strike through that.
So it keeps
Repeal.
keeps the repeal of the repeal.
Keeps the repealed.
And then what about the other one, the downtown?
So that would be repealed. So the Senate Finance, you would override the Senate Finance's amendment.
And we would strike that change, but the underlying program would still exist.
Correct.
3 million.
Correct.
And then we could decide later if we go to 3.5 million,
Right.
4 million. Or 9 billion. Okay.
9 billion?
You're gonna get
That's a little high.
Any other comments? Ledge Councilor, Jim?
I would just reiterate something that Rick mentioned, you know, the fiscal note reflects the language of the bill, but there are cases where the intent of some of the numbers are either including the governor's recommended amount or they're adding to it without referencing what the underlying governor's recommended amount is. Amy and I have been working on a table to track that, so hopefully by the time you get to the budget construct part of the conversation, those numbers will be clear to you what the intended full funding for these programs is coming to you from the Economic Development Committee has.
Okay, and you also struck even the small ones, like the task force, $9,600.
Yes.
Okay. Okay, so Senator West has moved the bill favorably as amended.
Not Watson.
Not Watson.
We look so much alike.
I just got a question on this. This is very, you all been doing this a lot longer than I have, obviously. This appears to be not quite, are we to understand that the governor's recommend and then they're suggesting moving monies from other agencies to cover the downfalls of what they want? Or I thought we.
The way it's worded, they would take money from within the agency for the purpose that they have in the bill, but they would assume that we were gonna add money to their budget to do so. It doesn't say that, but that's kind of what they assumed. But they don't specifically say move it from other agencies, they just say find another $3 million for brownfields.
Has this happened in the past? Didn't entertain like this or?
Well, that's what they kind of said.
So yeah, the sort of a unique situation last year was that you had a similar economic development bill. A lot of those appropriations got rolled up into the budget for those programs, but it was, I guess, House of Commerce felt it was important for the policy language attached to some of those dollar figure amounts to still be lived in a bill. And what was kind of strange about it was because typically the budget goes last, right? But this was an instance where the policy was following, like coming after.
We got the bill out early, so they House hadn't finished it, so they passed the bill, just kind of referencing the budget.
Yeah, so referencing dollar figures that had already been conferenced and agreed to in the budget, just, making sure that the policy associated with some of the money lives.
Yeah.
So I know what I'm doing. So this amendment takes out all the money.
Takes out all the money.
So we're gonna sit here and wait basically for the House to send over the budget to see before we make our next move.
Right.
Well, and Amy's got her
It
tracking
Well, we can't
document
take
and
the
all
language.
these
They
things
need
will
the
be there,
language, so-
so we.
Well, you
can
need
look at it,
something
make
Something.
decisions.
This just seems
The
unusual.
amendment takes out all the sections, so the language, any
Language that goes with the money.
any money that had language with it in that same section. So I don't know how many sections are left after we take them all out.
Let's see, section 1, the purpose statement, which we'll rework it.
And the effective date.
The effective date stays, all has been amended. And by the way, I will take the blame for not drafting this. I just used last year's
Sure, that makes sense.
style,
Yeah, yeah.
and it was working
Yeah,
until
yeah,
it comes to this committee. You're like, what is this?
Right.
And understandably so, it's different, but
Yeah.
next year we'll work on, not that every year's the same, but
The
hopefully.
governor likes this committee, the wisdom of this committee.
It'll be less of a shock.
So there are 3 studies that are cost neutral in this
She's
bill.
not shy.
They're staying, and the veggie repeal is staying, and I think it's just 4 sections.
Okay.
I don't mind you.
So happy. Okay, so does the clerk want to take back the helm? Because we had passed it on to the assistant clerk.
Yeah, he probably did do a very good job.
Yeah, I know. There were some questions.
Well, you didn't get the vote, so.
It's okay.
He didn't even call your name.
Really?
Retribution.
Okay, Senator Baruch,
Yes.
Senator Brennan, yes. Senator Lyons.
Yes.
Senator Norris,
Yes.
Senator Watson.
Yes.
Senator Perchlik.
Yes.
Senator Westman.
Yes.
The taste of your own
Yes.
West.
Okay, so we need a, see if Senator Watson.
Yeah, I'm,
Do we, need a reporter, or we do need a reporter?
I guess so.
Yeah. Does anybody want to report? I can report it, because it's weird.
It is weird.
That's what we think
What are you
about
trying to
economic
say?
development in the state.
I'll have to
After-
answer the,
after,
Clarkson, when she gets back to Italy,
Senator
found out
Clarkson left
reduced
just-
the bill.
This is expected, by the way. This is what that committee expected.